Kevin, cybersecurity is definitely one of the hottest topics today in the healthcare industry. I'm sure you'd agree with that. But as a matter of fact, PricewaterhouseCoopers called it one of the top 10 issues to look for in 2016 for the healthcare industry. Do you agree with that assessment?
Yes, I agree with the question, the statement. I think it's one of those no-duh type of answers, right? I had to fill something in my article, so I said cybersecurity is the most important thing.
Right.
But it really is, as we're seeing more and more attacks toward that. And to be honest, most organizations aren't prepared in the slightest for what they're trying to deal with.
Kevin, we are here in this space where healthcare IT is literally all around us. Your specialty, of course, is cybersecurity. So how does cybersecurity inform healthcare IT, or is it the other way around?
Well, I think one of the things, and this is something I've ranted about for years, so I'll try not to rant today. We have to stop thinking about security and IT as separate entities, right? The reality is they're one group that have to work together. Both inform each other. It's not a one-way conversation. So security is going to come to IT and say, here are some of the risks, here are some of the attacks, and here's what they do and how they work. And IT has to be able to come back and say, yeah, but this is the business critical functionality, this is the stuff we need to accomplish. And there's a third leg there, and that is the organization itself, right? You have to have all three working in tandem, or you're just going to have the mess we have today. It's going to continue and perpetuate and get worse.
It goes without saying that healthcare leaders of the future are really going to have to engage with the IT side of things to be effective. What, in your view, makes a good healthcare leader?
If you're going to be a healthcare leader, technology is where it's at today. Hospitals, health providers, insurances, whatever. IT is driving that business. It has to. It's making efficiencies, cost effectiveness, all that kind of stuff. And as you get all of this technology in, if you're not rolling it out correctly, you're going to have issues. And the leader is who's taking personal responsibility for that, right? That's one of the interesting things about HIPAA over all the other regulations, right, is that personal liability. So if you're going to be a leader, you have to at least understand what those threats are. And to me, that's what makes part of a great leader.
Kevin, we all watched in horror at what happened with Hollywood Presbyterian. Is that really the world we're living in now, where hospitals are going to have to pay thousands of dollars to hackers to get their data back?
Well, so part of my issue with that is that it implies that Hollywood Presbyterian was the first attack of this type against a hospital. It wasn't. It was the first one we really talked about. Ransomware, this type of attack has been happening for years. It's going against all levels of healthcare, providers, everybody, as well as people outside of healthcare. With regards to, looking on in horror as they paid, I cringed horribly for a number of reasons. One, you don't pay terrorists, right? The whole thing about that we've known for years. Every movie talks about it. But the fact that they paid implies, at least very strongly, that they weren't prepared. They didn't have the IT stability or even the security stability to react to that attack without paying that money. It's actually pretty simple for hospitals and providers to be prepared for ransomware. Have a good backup. Have a good backup that you know you can restore from, right? Right there. Now when you get hit with ransomware, you restore your files, you're back up and running. Yes, there's an outage, yes, there's a downtime, yes, it's awful, right? But from a basic, fundamental IT system, you should be able to recover from this type of attack very easily.
Right.
Of course, the goal is to prevent the attack to start with.
Right.
And the way to do that is the vast majority of these attacks are coming in through social engineering. Users are getting emails, they're going to social network sites, they're clicking links they shouldn't do. So one of the things that hospitals have to really look at, and we all should, but right in this case, hospitals, they should be looking at training their users as to what is okay to do and what is not. And really explain to them the why, right? Hey, this is why I'm telling you not to do this. Not just a, don't do that, right? The way I always talk about it is like when my kids were young, we didn't just say, slap their hand when they touch the stove. We said, that's hot, it will burn you, this is why we're telling you not to touch it. So the next hot thing they touched, were around, we didn't have to explain again by slapping their hand, they understood the why, right? And then after you teach people what not to do, then test it. Actually send in, control, don't just randomly do this, have somebody help you that can do it, but do testing of that. Send in test emails that pretend to be an attack, right? And then if your user clicks it, educate them more, right? Go back to them and say, hey, remember we said don't do this, here's why, and hey, you fell for the attack, right? So that way you get an idea of whether your training is effective.
Kevin, thank you so much for lending us your time and your insight today, and enjoy the rest of HIMSS16.
Thank you.